Hey everybody, and welcome back to my channel. It has been a little over 2 weeks ago since my biceps tenodesis and subacromial decompression. If you've been following me, you may notice that I'm not in a sling. This is not normal for me. I just got done doing PT, and right now I'm just kind of letting this shoulder and this arm just kind of hang and relax and stretch out. I asked my doctor about that, and he said it's perfectly fine, especially if it helps me feel like I get a little bit of blood flow and stretch out that bicep and the bicep tendon. So yeah, 2 Mondays ago, I got my surgery. Today's Thursday. I've just been kind of falling behind with things here at the house and trying to get stuff done so work doesn't fall apart. But yeah, a couple things I wanted to touch on. I'm starting to feel like myself again. Still don't have use of this arm fully. Now, what I say, fully, when this arm is in a sling or if I'm moving it out of the sling, it's always supported either by my hand or sometimes I prop I literally will bring my hand up with my leg like that in balance and keep my leg up, or I perch my leg up on something and my hand and my arm rest on my leg. But I've been trying to get to where I can lay this hand flat, and then notice I have to assist with the pronation and supination motion, palm down, and trying to get to where I can at least type and use that hand. It still kind of burns and stretches after a while, and I can't do it very long, but I am trying to get back to where I can start using this hand for the bare minimum task. Like I'm talking, if this is hanging in the sling, something as simple as toilet paper. The toilet paper roll will go over these two fingers, and I can pull the toilet paper off of it. I'm talking bare minimum task. But the point of all that is I'm trying to feel like, I'm trying to stay active, and I'm trying to feel like myself again. And with the pain pretty much being gone from the surgery, all but, burning sensations after PT or burning sensations after sitting on the couch the wrong way, and, this arm is not laying in the sling properly. I'm not really experiencing a lot of pain from the surgery now. It's all post physical therapy, sitting or laying the wrong way. But a few things I wanted to go over. So Monday of this week, I got my stitches taken out. There was so I've got 3 holes on top of my shoulder that they just like little holes, had stitches in them. Those scars are quickly going away, even now. Like you can still see them, but I know that probably in 6 months, I'm not going to be able to tell they were there. The biggest scar, I'm not going to gross you all out and show you, but there's about a 2.5, 3-inch scar right there on the inside of my arm where they actually did the bulk of the work. Now there was a piece of clear, like I think it's called Tegaderm or something like that, to where they stitched it from the inside, but they also put that film over it to protect it and help hold it together. They took that off as well. And it's holding together great. That happened Monday. Doctor said, hey, if your pain is, a 2 and, you're able to do what you're doing, you're actually doing really good. Then Tuesday was my first real physical therapy session. And all it was passive range of motion, passive movement. My therapist, she just assisted me. We're going to pretend like this is my hurt arm. So I would lay on my back, and she would take my arm and kind of cant it out a little bit like that and see how far behind me she could take it, bring it all the way back down, all the way back up, all the way back down. And then obviously towards the end of because she would do it like for 5 minutes at a time, I could go a little bit farther. Then and when I was laying on the table, she would put a towel under my upper arm to keep my shoulder from stretching back like that. So I was still laying on my back. Everything was on my back the first day. Then she would cant my arm out a little bit to take pressure off I think it's supraspinatus, and then do kind of rotation like that, passive rotation. She was doing all the work. She would do that, then she would cant my arm out to the side, and she would see how far out she could move it like this. And the whole time she was just kind of doing exercises, bringing my arm out, just doing different motions. And you will notice the first minute or two you do it, you're really tight and it kind of hurts. But then as you start to relax and as the muscles and tendons start to loosen up, you can go further. And it honestly feels really good. My first physical therapy session on Tuesday, I felt like a new man afterwards. Now, I was sore that night, but afterwards, where there was blood flowing into that area, it just felt like really slick, really clean, and really healthy. And I was really excited after that, because I thought physical therapy was just going to be miserable the whole time. So, and then again, I did physical therapy, same thing, a few more exercises this morning. And she also told me that not only can I do physical therapy there with her on these passive ranges of motion, she wanted my girlfriend to come in and watch what she was doing, so we could do it here at the house as much as I wanted to. So I'm going to start incorporating that. I really want my range of my mobility back. I keep getting hung up on that. My range of motion, my range of movement back, and I want my strength back soon. So I'm going to try really hard at PT at the actual the pavilion, the medical pavilion, and here at the house. Now, she did show me some modified stretches or movements. So like, and I was in a rolling chair, but you can do it in just a regular chair. So if I'm seated like this, sitting down, I would place, let's again use this arm. This arm would be at a 90-degree angle, resting on a table or something. And all I would be doing was leaning and then coming back. And if you start to do that, if you're leaning and coming back with this arm out and it's laying on something, what you're going to notice is you've got this motion going on, the adduction and abduction, and that's what she wants me to start working on. And on top of that, she continued showing me like, hey, you're doing good with the bow stretches where I hold my arm up on something and kind of squat down. And she wants me to keep doing that. She says, that's great. So PT, all in all, it's going fantastic for me. And it's starting to make me feel kind of like my shoulders getting healthier. And it really is like a hurts so good feeling. So not a lot of pain in a bad way. There's not a lot of grimacing and like gritting my teeth and sweating. It's odd. Honestly, it's like a good stretch out session. A good, like you just did biceps and you've got your hands out and you're stretching your biceps. That kind of stretch feels really good. And to get that blood flowing into those areas is just amazing. As far as medication go, I'm almost exclusively on ibuprofen, and that is only after PT, or let's say, a lot of times I'll sit on my couch and I'll kind of cant to one side, just kind of getting lazy with it, and I'll notice that shoulder's kind of drooping and pulling to one side, and I won't notice till I get up. I'm like, ooh, that's kind of sore. I take ibuprofen. There was one night I took half of a pain pill just because I wanted to help try to get some sleep, and the pain from watching a movie it had kind of hurt things in here, but nothing intolerable. And definitely, I hardly use those anymore because I'm more inclined to stay away from pain medication like that. Now, one thing my girlfriend's been really good at is reminding me to ice my shoulder in addition to medication. So that night that I took the pain medication, that half pain pill, I also iced for about 30 minutes. And you can definitely tell that if you don't ice at least once or twice a day, it swells, and that's when the pain comes. So I would recommend, even at this point, if you're still feeling that pain, ice it. Now, the tools I showed you in my first or second video, the Jar Hero mounted on the bottom side of my counter, that thing has saved my life. I don't know how I lived without that thing to begin with, just because it's so easy. You got a jar that's hung up, it's really hard to open, instead of just sitting there like testing your manhood every time. Just put it up underneath, boop, and it comes undone. It's great. So yeah, PT's going good. Medication, pretty much off of it except for ibuprofen, and ice. Use an ice machine, got that ice cuff when I need it to keep down the swelling. Still got probably 2 or 3 weeks left in the sling at least, and a good 2 weeks until I start driving again. So I had my surgery on November 20th. December 20th, I'm hoping I can drive, but it's not so much like, can I drive? If I had an emergency right now, yeah, I could hop in the car and I would drive. But here's the thing, it's solely one-handed. I would be holding the steering wheel with one hand, and this arm isn't just going to be tight to my chest. It has to be at a 30-degree angle. So if you think about that, your arm is in a pillow sling. It's right there touching the steering wheel. So it's going to be a hindrance the whole time. And if something happens to where you have to dodge out of the way, you need both hands. So it's a liability on yourself, and it's a liability for other people on the road. You just don't need to be doing that. You don't need to be on the road unless somebody is, hey, this is an emergency. I do not recommend driving. And I'm not a medical professional, so by no means listen to me. Listen to your doctor. When he tells you, he or she tells you to drive, that's when you should be driving. I got to be honest with you. This surgery has been a pretty okay experience for me so far. The sling, week 1, I started to notice it was very irritating for the skin and very mentally irritating for me to get used to. I was like, man, this thing's itchy and it's uncomfortable. Now it's just second nature. I really don't notice that I'm wearing the sling at all. I will say that one of the biggest issues I'm facing is just going stir crazy around the house, because I'm a big on cleanliness, and having the use of one arm, I can't really wash dishes the same way now. I usually only hand wash dishes. Now I have to soak them and then rinse them off and put them in the dishwasher. And I can't really, I can do laundry okay. It's kind of funny. I look like an orangutan because sometimes I use my feet and teeth to help fold towels and stuff. But going stir crazy a little bit around the house, but it's been okay because it's given me a chance to do and get to projects that I've not had time for. Again, though, you're at a 50% capacity because you only have one arm. I was talking to my physical therapist. As far as recovery, I'm pretty hopeful. If things keep going the way they are going, from 4 to 6 months from November, so around April-ish, May-ish, I'm hoping to be fishing, full-on casting again. You guys know me. I'm a fisherman. That's what recovery's looking like. Now, as far as sleep for me has been hit or miss here recently. A lot of it is on me because now that I have all this, now that I don't have to get up at 4 in the morning to go to work, I stay up a little later, and pair that with not truly being able to get comfortable yet, laying on my back. Sleep has been, I still get 5 to 7 hours of sleep, but I do wake up a lot and kind of toss and turn and reposition myself. Again, if you saw my first video, I have the wedge pillows, and a lot of times I've got a little half moon piece that stays up under this elbow and forearm. A lot of times that gets kicked off in the middle of the night, so I have to focus and staying kind of sleeping very still, like I'm on the top bunk of a bunk bed and I'm afraid to fall off, that kind of feeling. But then there's times where I'm just so exhausted that I sleep straight through the night and I don't really notice anything. And luckily I've not fallen asleep in a bad position doing that yet. But sleep, yes, it's changed, but not that much. So if you're going into surgery and you're thinking, man, my sleep's going to be gone for the next month, it's not going to be gone. It's not going to be heavily reduced, at least not in my experience. But it is going to change. You're going to wake up more often feeling discomfort in this area, and you're going to try to, scooch around until you can find that good area again. Now, as far as nutrition and health, I have noticed that I've lost kind of some muscle tone since I haven't been able to really lift at all, and I can't really go to the gym, I can't drive. And I don't really have any equipment here except for boxing stuff and a stationary bike. But I did talk to my physical therapist today, and she did say she didn't have an issue with me hitting a stationary bike. So I'm going to start hitting the stationary bike and at least keep my cardiovascular health up, because I can notice that even though I've been a runner for a while, despite my looks, I do get out of breath now because cardiovascular health is a perishable thing, and I haven't done anything in a while. So I'll be walking around the house or carrying in groceries with my good arm, and I'll be noticing that I'm out of breath a little bit. So I'm kind of looking forward to hopping on that bike again. Just got to keep my sling on, and yeah, looking forward to that. So moving forward, I'm still going to continue with twice a week physical therapy, actually at the medical pavilion, but I'm going to step it up here at the house. And my physical therapist told me that we could do the physical therapy that she showed me every day for up to 45 minutes a day. So I don't know if I'll kick right off into that because I don't want to overdo it and break anything. But you know, I'll do that. I've always kind of been the one to push the envelope and push my limits. And I don't want to necessarily push my limits, but I want to accelerate my rehabilitation. So yeah, looking forward to that. Some people have asked me, especially since it's gotten cold here recently, they're like, how's your shoulder feeling, Cameron? I would say the biggest thing coming out of week 2 that I can notice about my shoulder, besides the lack of strength in it, like it's always been kind of like a noodle for the past 2 weeks because I don't want to put any pressure on anything at all. But I'm starting to, maybe it's in my head, but I can kind of feel on the back of my arm where that anchor's at, because they drilled all the way through my arm bone and came out the back side and anchored. Kind of think of a stick tied to a piece of string. You turn the stick long ways, push it up through the hole, and then once it gets through the hole, you turn it sideways and it anchors. That's what they did. And I don't know if it's just my head, but on the back of my arm, every now and then I can feel like a little itching, burning, and I'm like, I wonder if that's that anchor. So I don't know. If you're wondering what your shoulder's going to feel like, just know that there's going to be random aches and pains and burning sensations, random cooling sensations. But all in all, if you're freaking out about this surgery, I'm a little bit past week 2 and I'm feeling a-okay. And maybe it's just me mentally being really positive about it, and I've kind of psyched myself up all year about this. But I kind of think that you all are probably doing the same thing. So keep it good up here. Keep good thoughts up here. And that'll translate to good thoughts and good feelings everywhere for the most part. But that's all I've got for you all. If you like these videos, click that thumbs up. If you're going through the same thing I'm going through, leave your experiences down below. I want to hear from you all. I really do think as I get older, I'm finding out that we're all in this together, like the Red Green Show used to say. And I'm pulling for you. And I really hope that these videos are helping you all out. And I know they're helping me out kind of document, because I want to see where I was a year from now. I want to look back on this and kind of see how things have changed. So anyways, thanks for watching, you all. And if this is your first time on my channel, feel free to check out some of my other videos. I do a lot of fishing and outdoor stuff. Thanks for stopping by, and I'll see you in the next video.